Yeah, please.
May I come in, sir?
Yes, come.
Good afternoon, sir.
आइए डॉक्टर साहब.
Thank you, sir.
डॉक्टर अनिल कुमार. It's slightly it wobbles, but settle down.
Yes.
This is your first exam?
No, sir, this is my second interview.
Second interview?
Yes.
Oh, how come? Okay, second interview. The subject was, option was the same?
Yes, sir, anthropology.
Anthropology.
Yes.
What was your performance interview last time, Anil?
Sir, actually, last time I didn't get my interview marks.
Okay, but it went well, is it?
Yes, sir.
So what do you think was the shortage, and you must have made it up in the written?
Yes, sir. Sir, I tried to improve in written because in optional I was scoring little less. So this time I have tried to improve it.
But even the other compulsory subjects you must have improved? No.
Yes, sir. Sir, I had decent marks, but I still tried to improve in GS subjects.
Good. Anil, so the obvious question first, why are you deserting medical service?
No, sir, I'm actually not deserting it, but when I was studying and doing my internship, sir, I felt a lot of problems could be solved by just administrative changes only. The greatest example is maladministration. Being a doctor, I can just cure or give medicines for the maladministration. But at the back end...
Okay, we get it. Let us put it this way. Obviously you do. But then your medical expertise, medical medicine, knowledge of medicine,
Yes.
as a discipline. Let us look at it positively. How are you going to use it among other things? Among other things,
Yes.
how are you going to use your services, your medical knowledge when you are a administrator?
Yes.
Administration comprises various sectors.
Yes.
Obviously, health sector also, isn't it?
Yes.
So you can leverage this,
Yes.
isn't it,
Yes.
into the health sector, which is very, very critical sector, along with education, isn't it?
Yes.
So
Sir,
let us hear you about that very briefly.
from being for the personal qualities, the qualities which I developed during my medical practice was stress handling, working under pressure. So these all things is also needed in administrative field. So I will be doing good in that field. Another, coming to the economic sphere, medical tourism in India it is lacking, and particularly in Odisha also it is lacking. But it is a very good sector which we can tap.
No, but Dr. Anil Kumar,
Yes.
the primary health centers, isn't it? What is the concept? Is the government trying to do something about the primary health centers? I think there are a lot of initiatives out there,
Yes.
isn't it? You are not talking about that. That is the cue and the clue we were giving, but you are refusing to talk about that.
Yes, sir.
Why?
Sir, community health centers and public health PHCs, sir, government is constantly improving their infrastructure, trying to incorporate a lot of new diseases which can be diagnosed at the primary level only.
Yes, exactly.
Yes, sir.
So when you are in charge of a subdivision or collector, isn't it?
Yes.
So that is there. Your eyes will be that of an expert.
Yes.
They cannot take you for granted, isn't it? So that is an area, because in other words, this medical knowledge will be absolutely critical in monitoring, overseeing that a very important sector.
Yes.
A private sector.
Because
so that is the answer we were looking for. Okay.
Yes.
Anyway, that apart. And now coming to the current news, national news. Elections were over in 5 states. What are the outcomes? Anil?
Sir, recently in Tamil Nadu TVK party, though it is not getting the magic numbers or the numbers required to form the government, but it is the majority party. And in Assam, clearly BJP is performing well, and recently West Bengal also, BJP has a clear standing.
But why is the former Chief Minister Mamata Banerjee, she says, I will not resign, I am not accepting the verdict. Normally, outgoing Chief Minister, they accept it in good grace, saying that we respect the verdict of the people, but Ms. Banerjee is not accepting. She says, no, this is not the verdict of the people. Yes. So what is the contention?
Sir, as she is mentioning, she has few concerns on the way the election was conducted. Sir, I think she is not satisfied with the process, the way the election was conducted, and
that is obvious.
Yes.
Madam Banerjee is not at all, she is agitated. But what about you? What is your considered critical, independent thoughts, Anil? Because this is a test of your personality.
Yes.
Obviously, with the, Ms. Banerjee is not such. She is very agitated. She has gone to the Supreme Court.
Yes.
That is that. But on this issue, what are your? We may agree, we may not agree. There could be divergent views. But what are your independent, critical views? That is a test.
According to me, at the recent, sir, what we are getting is the mandate of the people. People want a particular government to be removed and a particular government to be formed.
Excellent.
So we have to respect that.
Very
If some issue is there, then definitely legal way is there and she can go.
Wonderful. That's a brilliant answer, Anil. One more question and I will have done with you. So again I will come back to the health sector. So public health, primary health, being a health expert, medical doctor. So what are the reforms that should take place in the health sector or the public health?
Sir,
I know it's a broad,
yes, sir.
yes, but then because since you're an expert, you should give concise answers.
So the major, at first which we can do is improve the primary healthcare sector and infrastructure, because our tertiary healthcare sector is overburdened. Because at the primary level only we are not able to cure a lot of diseases and diagnose it.
Very good.
So,
and how do we go about it? Are we doing enough?
Yes, sir.
I agree with you that yes, we have to concentrate at primary level.
Yes.
Is enough being done? And if enough is not being done, how to go about it? In terms of budget?
We are trying, but still we have not reached the threshold, the required amount which we want to focus on. First thing, at the primary level, we need to diagnose the diseases. Because at the primary level, we don't have resources to diagnose the disease.
And the greatest resource lacking is the doctors themselves. Nobody is willing to go there. And even the few left out, they are trying to get into administrative services. And this is the biggest problem. What is this problem?
Sir, I agree, but government is giving incentives to work in.
Is it sufficient? If they are incentivizing, but the incentive is not working, that means it's not adequate.
Yes, sir. Sir, another thing which we can do is we have other services like Ayurvedic services at primary level. They are sufficient, so we can design a specific program for them. At the primary level, they can treat some allopathic diseases.
Excellent.
Or perform some minor surgeries.
Sorry, we are
Okay, Anil Kumar.
and
Have you finished your internship?
Yes, sir.
What are you doing now?
Sir, I am currently preparing for the civil service.
You have not joined the government
Sir, I
job?
am not, sir.
Not interested in that? At
No,
all?
sir, I am interested, but currently I am fully focusing on civil service only.
But that would have given you the advantage of getting into the PG program? But that you are not looking for?
Sir, no, I am not appeared for the PG.
Not attending.
No, sir.
Okay, you tell me the story of Nagada. It is a problem of health.
Yes, sir.
What is the problem? Why the entire nation was concerned about this particular problem?
Sir, it was in news because of malnourishment only. Because the children at that age and tribal belt also, so they are malnourished at a massive scale. They don't know about the basic nourishment, balanced diet, they don't know about it. That's why.
No, that is across the whole country. Many people are within this scale. But what was that particularly that took the notice of the whole community and the whole governance, and even central ministry also was? That's the unique institutional case of health service utilization, health seeking behavior of the people, and the lack of the lackadaisical characteristics of the governance. Three different dimensions are very clearly manifested in this Nagada case. Physical location, the village was on a hilltop.
Yes.
Nobody has access to that village during the last 5-6 years. Any of the government officers have visited? Never. How can they be aware? We talk of a lot of programs of health awareness.
Yes,
Nobody has visited to that village.
Yes, sir.
So like these are very interesting stories. If you are interested, you can.
Yes,
Because that may be a very good option for you to know that how the system is functioning. We have systems in place, but they don't get reaching to the need.
Yes.
So what is the status of NRHM now?
Sorry, sir. Don't have.
National Rural Health Mission
Yes,
is,
sir, I know about it, but status.
it is a part of your public health program.
Yes, sir.
Is it there or not? First of all.
Sorry, sir. I don't have clarity on it.
କେମିତି ମାନେ ମୁଁ ତ ଆସିଛି ଲାଗୁଛି I am surprised. The NRHM has gone. There is no more NRHM. It has changed to NHM, National Health Mission. When it was started with National Rural Health Mission. Target was the rural areas. But subsequently urban areas were also taken into the ambit of the program, and that NRHM was turned into NHM. Now NHM is functioning. And what are its components that you are supposed to know also?
Yes.
Something about that. What is NHM? What they are doing for this?
Yes, sir.
It is meant for all three, primary, secondary, tertiary. But you have to know that. What is your native place?
Sir, I'm born and brought up in Bhubaneswar.
Born and brought up in Bhubaneswar. Studied in St. Xavier's, then moved to Cuttack and
Barampur, then.
Barampur, and then started thinking of how to get into the civil services.
Yes.
So, can you tell some of the endemic diseases? So there are certain diseases which
Yes.
becomes endemic. What is those?
Sir, endemic diseases are diseases which are found in a particular belt. For example, Japanese encephalitis. Some genetic diseases also, like sickle cell anemia, thalassemia. So these are mostly found in some particular belt of a country or a state.
So they are called as endemic.
Endemic.
Do we have something like that in Odisha?
Yes, sir. We have Japanese encephalitis.
Where it is? Mostly.
Mostly in tribal belts only.
Tribal belts.
Yes, sir.
Sickle cell anemia is
Yes,
also
sir,
there.
tribal belt. Genetic predisposition is very high.
So why Odisha records highest casualty, human casualty in malaria? Malarial deaths.
Sir, malaria is a completely treatable disease, but the outreach, we are not able to reach those areas in tribal areas because they are not able to get the basic medical facility they require for the treatment of malaria.
But across the country, all the people are getting, and we are only not getting in Odisha.
Sir, because some tribal belts are inaccessible to medical infrastructure, and
That
major
saves it.
reason.
Please try to look at. India has many such diversities, places of uniqueness, remoteness, where also the services are not available.
Yes, sir.
But there are people.
Yes, sir.
Forest area, tribal area, there are across the country there are. But Odisha figures the highest in death, malaria death. That's the important point.
So another thing is they believe mostly on the local practitioners, and they think it is means curse of God. That's why they are having the disease. So they are not getting treated for the malaria, which is a simple disease which can be treated easily.
You have to think of in a different dimension. Whatever you are telling, those are also available there with those tribal people.
Yes.
Odisha is not the only tribal state.
Yes.
Jharkhand is there, Madhya Pradesh is there, northeastern states are there, they are totally tribal.
Yes.
And so problem is not everywhere cropping up, Odisha is on the record. Something you have to think in giving a better answer. That what can be a solution and what can be the cause for this problem. Maybe climate to some extent related, maybe the behavioral aspects of the people, inaccessibility of the services, or maybe unutilization of the services. Still, primitive tribes more in those who do not seek medical services,
Yes, sir.
because we have the highest number of primitives in the country. There are different areas. Try to look into that. I think, sir. Okay.
I think you have completed MBA from MKCG
Yes, sir.
for 5 years.
Yes, sir.
You spent there.
Yes, sir.
Then what is your observation of that area, particularly the people are suffering?
Sir,
Major.
major thing which we have in mostly in Barampur region is HIV. So it is highest in the state.
And besides that,
So genetic diseases are also sickle cell anemia is high. in
sickle
the-
cell is everywhere, all mountain area, Narsinghpur, Cuttack also encephalitis is there,
Yes, sir.
isn't it?
Yes, sir.
So suppose we normally call that prevention is better than cure.
Yes, sir.
Health education should be given priority.
Yes, sir.
Why government is not taking care to have R&D in health sector particularly? More research should not be there. Is not there, is not floating among these ones. Past MBBS means going for MD or MS and getting a job and earn money,
Yes.
isn't it?
Yes, sir.
Private service is more and more than the government service. Why it happens? How to curb it? Suppose you will be given chance to go for, you will be environmental minister of environment. So you have MBBS degree. How can you mixed admixture of those two areas?
Sir, currently the part we are focusing is only on giving service and not on the preventive aspect. Sir, for preventive aspect, we need to focus on R&D. Without that, we can't do anything. Sir, and R&D can be only performed in, as far as a recent condition is, it can be only performed in tertiary centers. But we have a large center of PHCs from which we can get a lot of data. So if we can connect the PHCs with the tertiary centers.
Digitalization is already there.
Yes, sir.
So you can get the data easily.
Yes, sir. So then next step is we want to collaborate with or cooperate with international organizations like WHO. Then only we can perform research at a large scale.
It's not being done. What is placebo?
So placebo effect means simply if we are trying to test a drug, we generally give the real drug to a person, and in placebo we don't give the real drug. We just let him know that we are giving him drug, so that he doesn't feel that he is not given drugs. Then we try to analyze the effect is psychological, mindset, these all things. This is
Very good.
placebo.
Okay, thank you.
Good, doctor. We are stopping here for want of time. But as the mock was progressing, you came into you were in your element, because that is your area. I don't know how the last interview was. Did they engage you on the medical aspect, or how was the last
So
interview?
it was mixed. IR questions were there, medical aspect also, functional aspect also there.
So we are not taking it to other areas. But I think since you have done already, you know which paper you are reading, studying.
So currently I am reading Hindu and Times of India.
Okay. Vipassana, meditation, promotion. You are not going into that because you have already done it. Okay. So you are really an outstanding candidate, and then you should play to your strength.
Yes.
Okay. And then when the board is expecting you to talk about the particular expertise which you will bring to bear on the ground, you should be happy and enthusiastically talk about it. Initially you are trying to avoid it. So you need not be on the defensive. Like any other subject, this is an excellent subject for you, where immediately with determination and courage and focus, you say, yes sir, I am a doctor, but I will bring my medical knowledge to the, among other things, to the health sector, which is a very important sector along with education. That is how you do it. So dedication, don't waste time on this. Okay? Play to your strength. This is my area of domain expertise, I will use it. Okay? Wonderful, any question you would like to ask? All the best. You are making a mistake, eh? God bless you, doctor. God bless. We have placed you here 210, which is on the lesser side. Okay? Potentially small.
Yes, definitely. Thank you, sir.